Hi, I'm Ardis Watkins. I'm Government Relations Director with Scenic, and I'm here today with Jimmy Davis, the second Vice President of Scenic, and I'll tell you why we're here. This is a very important video, especially if you live in the western part of the state. The video is about the dispute between Blue Cross Blue Shield and Mission Health, Mission Health being a large hospital in Asheville. In a nutshell, Mission Health has ceased accepting Blue Cross Blue Shield as an insurance. So if you're a state employer or a retiree who's not under one of the different retiree plans, you can't use Mission Health and be under the state health plan right now. So that is a big deal. And the gentleman, one of our only top officer who's from the West is Jimmy Davis. And so I have heard so much from you about this because you've been so concerned for the members out here. Tell me, Mission doesn't accept Blue Cross anymore. What does that mean for y'all?
It means we're going to have to go out and search out new providers for our treatment for our conditions such as diabetes or cardiologists. I myself have used the Mission Health system for cardiology problems, and I do have sugar diabetes, which I also go to them for. It means that we're going to have to go out and find new providers and basically start over with our treatment and where we're going with our treatment and getting help.
So if I'm watching this video, first of all, don't hit stop if you're not from the West and stop watching this video right now.
Exactly.
Does this affect all state employees or just those in the West?
Right now it only affects the state employees in the West, but the problem that we see in the future is if Mission Health is able to pull this off, break the contract, and receive a bump in pay to join back to the Blue Cross Blue Shield system, then other providers across the state will have a domino effect, and they'll try to do the same thing, which will cause our health insurance costs to skyrocket. We've just faced an increase in the last budget system where our health care went up. We no longer have a free insurance. We are having to pay for all of it. And Blue Cross did hold the line and said, no, we're not going to give you a bump in pay or a bump in your increase, because that would have to be passed on to the members. And with us just facing an increase that we just had, I appreciate Blue Cross holding the line on that and not giving in to the increase.
So that is ultimately what Mission wants. They want more money from the state health plan?
They do. They're wanting more money, and that comes off the backs of the state employees and the members of the Blue Cross Blue Shield system. That does not just affect state employees. Buncombe County is on with the Blue Cross Blue Shield system. Therefore, they do not have the health care with Mission now that they had. So it's 260,000 people right now in the West alone that is facing this issue of what do we do now.
You mentioned Buncombe County. I read that Buncombe County employees just voted and told their employer, the county, that they wanted to stay with Blue Cross. So what's going on? If they know they can't go to Mission, why would they do that?
Well, they did vote to stay with Blue Cross Blue Shield. We're glad they did, and I know Blue Cross is glad they did, but there is other providers in the area up here in the West that are very good providers. Most of us have just become accustomed to going to Mission to receive treatment. Buncombe County felt like that was still their best avenue, as the way I understand it now.
Okay. So Blue Cross apparently reached out to you and the district chairs from the West who've been trying to get help for their members of their districts. And what do you think you learned when you talked to them?
We had a good meeting with Blue Cross Blue Shield. The ladies that came and met with us explained what was going on. They did provide a listing of hospitals in the area that we can go to that does still take the Blue Cross Blue Shield payments, still an in-network provider. And we discussed what it would take to get Blue Cross and Blue Shield and Mission back together for the people of the West. They did continue to tell us several times that we can still go for emergency treatment to Mission Health.
That's important. Remember that. You can still go for emergency treatment to Mission. You need to know that.
And my question to them was, in the follow-up of that statement, if we do go for emergency treatment to Mission Health, what happens then? If you're admitted, do you go out of network or will it stay in network? I was assured, and I have an email from Blue Cross Blue Shield that states if you go into Mission Health for emergency treatment and are admitted for that purpose, you stay in network cost. They will cover you at in network cost. That is huge because we don't want to go somewhere for treatment for an emergency care and then have to go to another hospital to be in network or have to face higher copays and deductibles in the
It's
end.
very valuable information, and again, just spread the word among all the state employees that you know out there. If you have an emergency, don't delay. Go ahead and go to Mission, and I'm glad y'all got that information. Y'all have done a great job out here in the West getting the information for your members. I've never seen anything like it. You're driving all of us crazy. That's a good thing.
Yeah.
Have you heard from Mission? Have they asked to sit down with you?
The only outreach that we have had from Mission, speaking for myself, was I received a self-addressed stamped postcard that I could sign saying that I support Mission Health in their endeavors to raise the copay and deductibles to them. I did not sign it because I do not support higher copays and deductibles. They're already receiving some of the highest returns on their money that of any hospital. So I don't really feel like that right now the time is right for them to seek an increase against us. And this will come off the backs of the employees. This will not be absorbed by Blue Cross Blue Shield. It would be out of our pockets.
So what you were saying earlier sounds like you believe this hardball that Mission's playing might result in every hospital saying, hey, I need more too, or else I'm shutting the doors.
Exactly. And each hospital that sees this, and they're watching, other hospitals across the state is watching to see what happens. And that would be the next step. Mission gets more money, the next healthcare system would come along and they'd say, well, we need more money now. So it's going to be a domino effect. It's going to be a very negative impact for our state employees.
So one last question, what should folks do if they have health issues?
They need to go on to the Blue Cross Blue Shield website, and there is a continuity of care paperwork that they need to complete. That will give them 90 days to continue treatment through the Mission Health system at an in-network cost, but it will also allow them time to go out and seek out another provider so that when that continuity of care term runs out, that they will have a provider ready to take on their treatment.
Awesome. Well, thank you. I mean, that's also valuable information. Y'all definitely fill out that continuity of care form if you need that. Any final thoughts on this issue?
As we'd stated before, Buncombe County, some of the agencies from up in that area are also members of the Blue Cross Blue Shield provider system. Us as Scenic maybe should get together with these agencies, try to join a coalition, maybe we should say, to see if we can bring more attention to this for our employees, to try to get Mission Health and Blue Cross Blue Shield back to the table, back to negotiating. This is becoming a burden to the state employees to try to go out and seek out other providers. So we need to try to get this worked out as quick as possible, and we want to help work it out. We don't want to sit back and wait. We want to try to help work this out.
Perfect. Well, you heard it from your second vice president himself, who's worked so closely with the district chairs out here. Scenic district chairs, as usual, working so hard for their members. I'm so proud of all of you. And if there's questions anybody has, please call the Scenic office or email Tony Boo in the Government Relations Department. We'll put his email up on the screen. We are here to help you. Like Jimmy just said, we just want to make this better.